Last Tuesday morning, I watched a 91-year-old woman walk into my clinic carrying 2 heavy grocery bags. No cane, no walker, no help. Earlier that same morning, a 67-year-old man needed assistance just getting out of the waiting room chair. And after years of treating seniors, one question still stays in my mind almost every day. Why do some people lose their mobility at 65 while others stay active into their 90s? Because I need you to understand something very clearly. It is not always genetics, and it is definitely not just luck. In fact, many people start damaging their joints years before they ever feel serious pain. And tonight, I want to show you the exact habits I repeatedly see in seniors whose joints stay surprisingly strong deep into old age. Some of these habits are so simple that most people completely ignore them. But one of them especially surprised me because it starts right before bed. And if you are over 60, this one small nightly habit might quietly change the way your body feels in the morning. Stay with me, because what most people think is normal aging often is not. Let me ask you something honestly. How old are you right now? 70? 76? 82? Now here is the more important question. How old do you feel when you first stand up in the morning? Because that moment tells you a lot about your joints. Maybe your knees feel stiff walking to the bathroom. Maybe your back takes a minute to straighten out. Maybe stairs have started feeling like negotiations instead of movement. And the scary part is this. Most seniors think this decline happened suddenly, but it usually did not. Joint problems build quietly, very quietly. A little stiffness here, a little inflammation there, less movement, more sitting. And then one day, your body starts avoiding things automatically. You stop taking walks. You avoid long grocery trips. You stop gardening. You sit instead of standing at church. And slowly, life starts shrinking around your pain. That is the part nobody talks about enough. Joint pain is not only physical, it steals freedom, confidence, independence, and sometimes identity. Now here is something most people never hear from their doctor. Pain is often the final stage of the problem, not the beginning. Meaning, by the time your knees hurt climbing stairs, inflammation may already have been quietly building inside the joint for years. And inflammation is sneaky. It does not arrive dramatically. It builds slowly, like a small fire that never fully goes out. A little inflammation is normal. Your body uses it to heal injuries. But chronic inflammation is different. Chronic inflammation is like leaving a tiny fire burning inside your joints 24 hours a day. Eventually, that heat starts damaging cartilage. Now let me explain cartilage in simple language. Cartilage is the smooth cushioning between your bones. It is what allows movement to feel smooth instead of rough. Healthy cartilage is the reason walking feels easy. Damaged cartilage is why movement starts feeling stiff, grinding, or painful. So the real question becomes, what feeds inflammation and what calms it down? Because this is where my healthiest 90-year-old patients do things differently. And surprisingly, most of it starts in the kitchen. Think honestly about what you ate yesterday evening. Processed snacks, sugary desserts, white bread, soda, packaged frozen meals. Now here is the hard truth. Many ultra-processed foods increase inflammatory activity inside the body. It is almost like quietly pouring gasoline onto that inflammatory fire. But here is the encouraging part. The body can respond incredibly well when you begin giving it better tools consistently. One of my patients, Eugene, taught me this better than anyone. Eugene was a retired farmer in his late 80s. The first time he came into my clinic, he pushed himself out of the chair using both arms because his knees hurt so badly. And I asked him something very simple. Eugene, what do you miss doing most? He looked down for a second and said, walking without thinking about my knees. That answer stayed with me, because when movement becomes something you fear, life becomes smaller. Now listen carefully. We did not dramatically change Eugene's medications. We changed his nightly routine. Every night before bed, Eugene started drinking a simple anti-inflammatory drink. And no, this is not some expensive internet supplement. This is what he used. 1 cup of warm almond milk or low-fat milk, half a teaspoon of turmeric, a small slice of fresh ginger, and 1 tiny pinch of black pepper. That is it. Simple. Now here is why this matters biologically. Turmeric contains a natural compound called curcumin. Curcumin has been studied for years because of its anti-inflammatory properties. Simple version? It may help calm some of the inflammatory activity happening inside the body. Ginger has also been studied for stiffness, circulation, and inflammation support. And black pepper matters because it helps the body absorb curcumin far more effectively. Without it, much of the turmeric simply passes through your system unused. Now let me be very honest. This did not magically fix Eugene's knees overnight. That is not how joints work. And honestly, anybody promising overnight joint healing is usually selling fantasy. But something started changing slowly. By week 3, Eugene noticed he was standing up with less grimacing. By week 6, he walked to his mailbox without stopping. Months later, he walked his granddaughter down the aisle. No cane, no dramatic announcement, just steady steps. And those quiet victories are the ones that matter most. Now I can almost hear some people thinking, Doctor, movement hurts. Why would I move more? And I completely understand that fear. But here's the strange part. The more your joints hurt, the more tempting it becomes to stop moving. But biologically, that is often the exact opposite of what your joints need. Inside your joints is something called synovial fluid. Think of it like oil inside a car engine. Now imagine leaving your car parked in the garage for 6 months. What happens? Everything gets stiff, sluggish, sticky. Human joints behave similarly. Movement helps circulate synovial fluid around the joint. That fluid carries oxygen and nutrients to cartilage. This is why doctors often say, motion is lotion. And no, I am not asking you to run marathons. Actually, many of my healthiest 90-year-old patients do very gentle movement, but they do it consistently. That consistency matters more than intensity. Here are 3 simple movements I recommend constantly to seniors. Number 1, seated knee lifts. Sit tall in a sturdy chair. Slowly raise one knee toward your chest. Lower it gently. 10 repetitions each side. Number 2, ankle pumps. Straighten your legs slightly and point your toes away from you, then back toward your face. Simple movement, but surprisingly effective for circulation and stiffness. Number 3, the 10-minute walk. Not power walking, not a workout, just 10 calm minutes after dinner. One of my patients, Dolores, was 82 when she told me, "Doctor, I think I'm just old now." But then I asked her something. "What do you miss doing most?" And she answered immediately, "My roses." She used to spend hours gardening. Now she avoided even walking outside. So we made one agreement: 10 minutes of walking after dinner every night. That was it. 3 weeks later, she told me she had started working in her garden again. Now, did walking magically erase arthritis? No. But movement reminded her body that life was still happening. And the body responds to movement remarkably well, even later in life. Now, let me tell you one mistake I see seniors make constantly. They wait for motivation before they move. That almost never works. Healthy seniors do not always feel motivated. They simply protect the routine. That is the difference. The healthiest aging bodies are usually built on boring consistency, not motivation, not extreme diets, not miracle supplements, consistency. And honestly, that should encourage you, because consistency is achievable. Now, here is another thing most seniors are never told. Your cartilage is made largely of water. Some areas are close to 80% water. So let me give you a simple picture. Imagine a dry kitchen sponge. When you squeeze it, it feels stiff and brittle. Now imagine a hydrated sponge, soft, flexible, absorbent. That is similar to the difference between dehydrated cartilage and hydrated cartilage. And here is the problem. As we age, the thirst signal weakens. A younger body screams for water. An older body often whispers. So many seniors walk around mildly dehydrated every day without realizing it. Then they wonder why their knees feel crunchy and stiff. And here is something I hear all the time. "Doctor, I avoid drinking water because I do not want to wake up all night." I understand that concern completely, but many seniors accidentally trade hydration for stiffness. So here is the hydration pattern I recommend most often. 1 glass of water after waking up, 1 glass with meals, another glass earlier in the evening instead of right before bed. And remember, hydration is not only plain water. Broth counts, herbal tea counts, water-rich fruits count too. Now, hydration alone will not reverse severe arthritis, but I have absolutely seen stiffness improve simply because somebody consistently hydrated better. Sometimes the body is not broken. Sometimes it is dry. Can I tell you about the patient who changed how I think about aging forever? Her name was Ruth. She was 92 when I first met her, and honestly, she did not even want to be in my clinic. Her daughter scheduled the appointment. Ruth sat quietly staring down at her hands. So I asked her gently, "Ruth, what do you miss most?" And after a long silence, she said something I will never forget. "I miss standing during church hymns. Not traveling, not dancing, standing." She told me her knees hurt so badly that she had started sitting through most church services. Then she said quietly, "And I'm afraid to hold my great-grandson because I'm scared my knee might give out." That moment stayed with me because joint pain steals more than comfort. It steals confidence, identity, connection. So Ruth and I made a very slow plan. No extreme workouts, no miracle cures. We added the turmeric and ginger drink. We added gentle chair marching during the day. We improved hydration slowly. And most importantly, we stayed consistent. 6 months later, Ruth walked into my clinic wearing a bright pink sweater and smiling. She said, "Doctor, I stood for the first hymn last Sunday. Then she showed me a picture of herself holding her great-grandson, standing confidently on her own 2 feet. Ruth passed away years later at 97, but for the final years of her life, she got part of herself back, and that matters. Now, I need to say something important, because real medicine requires honesty. If you have severe bone-on-bone arthritis, a torn ligament, advanced rheumatoid arthritis, or major joint damage, you may need imaging, physical therapy, a specialist, or even surgery, and there is no shame in that. What I am teaching you today is not a replacement for medical care. These habits are support tools. They create a healthier environment for your joints, but they are not magic. And please do not stop medications prescribed by your doctor because of a YouTube video. Now, with that said, for many seniors with mild to moderate stiffness, inflammation, osteoarthritis, or age-related mobility decline, these small habits can absolutely improve quality of life over time, not overnight, but gradually. And sustainable improvement matters far more than fake miracle promises. So let me leave you with this. My healthiest 90-year-old patients are not perfect people. They are not spending thousands of dollars on supplements. They are not biohackers, but they do respect consistency. They reduce inflammatory habits. They move every day. They hydrate intentionally, and they refuse to completely surrender their mobility to aging. That mindset matters more than most people realize, because aging does not automatically mean losing your independence. You still deserve to walk comfortably through the grocery store. You still deserve to visit your church, your garden, your family, your grandchildren. You still deserve a body that supports your life instead of limiting it. And sometimes the path toward feeling better starts with surprisingly small decisions repeated daily. A short walk, more water, gentle movement, a warm anti-inflammatory drink before bed. Simple things. But simple does not mean powerless. In fact, the most powerful health habits are often the ones simple enough to repeat for years. So tonight, before you sit down for the evening, drink the water, move the joints gently, take the short walk, and remind your body that life is still happening. Because even in your 70s, 80s, and 90s, the body can still respond to better care. This is Dr. Velmora. If this video gave you even a little hope today, subscribe to the channel. Every week we talk about senior health, mobility, inflammation, energy, healthy aging, and practical habits that actually matter. And tell me in the comments, what activity do you miss most because of joint pain? Walking? Gardening? Traveling? Dancing? I read the comments and I truly want to hear your story. Take care of yourself and be kind to those joints today. I'll see you in the next video.